Welcome to Nikayo TV. So last time we discussed about pathophysiology of COVID-19 and today we are going to discuss the symptoms of COVID-19. But before that, subscribe to my channel and don't forget to like the video. So let's begin. So we have divided the symptoms of COVID-19 into three groups: respiratory symptoms, systemic symptoms and other symptoms. So beginning with the respiratory symptoms. So first one, the mild symptoms we all know: cough, cold, sore throat. So out of all of these, cough occurs in about 54 to 60% of the patients. So it's most common. Next, the symptoms get a little bit more complicated, as in dyspnea, where there is difficulty in breathing; wheezing, when there is a sound while you breathe. That occurs in about 9 to 25% of the cases, and dyspnea occurs in about 20 to 28% of the cases. Now hemolysis is a rare symptom in which you start coughing up blood, and that occurs in about 1 to 2% of the patients. Moving on, if there is further complication, there may be pneumonia in the patient and it might lead to respiratory failure also. Now let's see the systemic symptoms. In systemic symptoms, fever, rigors, and in rigor, now what are rigors? Rigors are sudden feeling of shivering and feeling cold with a lot of sweating. So as in high fever. It occurs in 13 to 22% of the patients. Moving on, myalgia and fatigue. Fatigue is seen in 27 to 35% of the people. And myalgia, that is muscular pain, it is seen in about 14 to 20% of the patients. These were our systemic symptoms. Systemic means relating to the entire body. Now let's see the other symptoms. In other symptoms, we have headache in 10 to 16% of the patient, confusion in 7 to 15% of the patients, and there might be ataxia also in very complicated conditions. Then the abdominal pain, vomiting, diarrhea, the GI symptoms, they are about 15 to 37% in COVID positive patients. So it's a big number. Now seeing the other symptoms. Other symptoms include chest pain and tightness, otalgia, that is pain in the ear, then conjunctivitis, also called pink eye, and anosmia or hyposmia, which is the most common, seen in about 4 to 55% of the patients. Now, moving on, let's see. Now these COVID positive patients, 80% of them develop mild symptoms, okay, like cough, cold and sore throat, etc. And 20% develop intermediate to severe symptoms. And about 15% of them respond to oxygen therapy. These are these 5% out of this 20% that do not respond to oxygen therapy. Now seeing the timeline, this is the first day, this is 5th day, and this is 1 week of this disease. So first day is the one when your symptoms start appearing. Now on 5th day, there is development of dyspnea. Dyspnea is difficulty in breathing. Now this is due to something called cytokine storm. Cytokine storm is due to release of secondary mediators called cytokines, called interferons. Most common of them is interferons and tumor necrosis factor that are responsible for such a symptom. And that's when you need hospitalization and treatment by the doctor involving steroids. Okay, so that's it, guys. That's what I wanted to talk about for today. Please subscribe to my channel. Don't forget to like the video. Thank you.